Good morning, everyone. Thank you for being with us today. We're going to talk about the Local Health Act. To let you know, we're going to have Representative Debbie Wasserman Schultz from Florida. We have Hank Johnson from Georgia, Sylvia Garcia from Texas. We'll be later joined by a couple of other members from Florida. We'll see them when they come up. And we have Mayor Sherry Petrolia from Delray Beach, who we'll get to in a minute. Again, thank you guys for being with us. You know, here in Florida, in 2 weeks, our governor plans to hold a special session to pass legislation that would ban local governments, agencies, and from mandating COVID-19 vaccines for their employees and punish private businesses that do the same. And this would be piled on top of a state that's already prohibiting businesses from requiring proof of vaccination by customers, an issue being contested by our cruise lines in court. And this is in addition to the bullying, the threatening, the withholding of money from school boards trying to keep students and teachers from illness and death by requiring mask wearing. And we've seen similar efforts in at least 13 other states where elected officials are putting politics over the health and safety of their communities. There seems to be a race to the bottom by governors wanting to score points with a certain political wing of our country. So we are here to say that local governments, agencies, and private businesses in communities that want to follow CDC guidelines should be supported, not punished. The Congress members on this call, along with like-minded members, are going to file legislation known as the Local Health Act that protects us from the dangerous overreach by states that we've been seeing all across the country. And this bill would protect the ability of local governments, agencies, and private businesses to implement common sense public health and safety measures recommended by the CDC. All aimed at curbing the spread and death from COVID-19. This includes requirements such as social distancing, mask wearing, vaccination, and testing. What we're talking about today is not a federal vaccine or mask mandate. It's importantly giving employers the ability to follow CDC guidance to keep their employees and customers safe. And it would supersede any state law that blocks that. And put this in perspective, our country has lost almost 750,000 people to COVID. We're closing into 50 million COVID cases. And listen to this, 21,000 Floridians died over the past 4 months alone during the Delta surge. 380 Floridians are still dying every day on the average. And let's put this in context. 23,000 Floridians died in all of 2020 before vaccines were available. I'm going to try to say that again. We've had almost as many deaths after we knew about the vaccines here in Florida as before. So here's the thing. We know how to stop the spread of COVID and stop the tragic deaths. Vaccine requirements, mask wearing is working, and we are here to put health and safety win over politics. And with that, I want to introduce our local mayor, Shelly Petrolia. She's going to tell us what she's been doing in Delray Beach, Florida, and how it's been working. And I also want to say hello. I see Charlie Crist has joined us. We'll get to you in a moment, Charlie. Okay, Mayor.
Well, thank you so much, Congresswoman Frankel, for having me here today with this team panel that you have put together. And I just want to, first of all, say that your courage and leadership in our government to champion this issue has been nothing short of fantastic. We started out in I think all cities with very little, I believe, leadership from the top down. There was a local requirement to have to deal with this COVID issue from the get-go. We didn't have any understanding of where to go. So locals did start with the different mandates or different requirements that we made for our area in government. Delray Beach was one of the first to have a mandatory mask mandate before anybody was questioning whether or not that was a good or bad thing. We were requiring anybody going into any business to, and this was during the lockdown portion of COVID, to wear a mask. And it also included all servers. So that was one of the things that we did at the very beginning. Unfortunately, once we opened up the doors again, we were kind of guided by our local health department to release that mask mandate because it was going to be too difficult to enforce. And we understood that since we were one of the very few that were actually doing this at that time. But at a local level, what we did do is we started to move down a path of how do we make sure that we can have safe environments for people to come in, because we are obviously a service-oriented business, which, you know, the municipality is always dealing with the public. So we require the public to come in with a mask mandate still to this day. And what we also did was to make sure that our the health of our employees was there. We have a it's not a mandate, but we require everybody to do one of two things, which is to either get vaccinated and show proof of that, or they would have to have, you know, a weekly, what do you call it, a COVID test. So that is still in effect. To date, we have 2 of our unions that have climbed aboard. And one that has not. I know that has been the biggest pushback for municipalities, is whether or not unions will jump on board. We had no problem with 2 of the unions. The police union, unfortunately, we did our, we were dealing with the police union contract prior to this, so we didn't have that opportunity. However, the fire union is on board. They are about 85% vaccinated. Our union that the most recent union that we just got on board is SEIU, and our services union is at about 70% vaccinated, and our non-union employees are at 85% vaccinated as well. We do allow for people to get their vaccinations every Tuesday, and that is the public at large as well as the city employees from certain times. I believe it's 9 to 12. If somebody needed one other than that, or a home visit, we can actually, take care of that as well. So we're doing everything in our power in order to be able to bring vaccinations up in our locality and do the responsible thing, which is to follow the CDC guidelines and really push towards getting vaccinations out and about. So that's what we're doing.
Thank you so much, Mayor. And
Sure.
I'm going to yield over to, I just want to say hello. I see Representative Soto joined us this morning. Thank you. We're going to yield over to Representative Wasserman Schultz.
Thank you so much, Lois, both for this important legislation and for pulling all of us together. And Mayor, thank you very much for your leadership in enacting and trying to make sure that everyone follows really important public health practices. That's what's going to keep us all safe. And we really need to be kept safe, because Americans face a double whammy. A deadly pandemic still rages all around us, yet we're all worn out from COVID precautions. Small businesses are taking it from both sides too. They have to wrestle through pandemic bottlenecks and employee shortages, then turn around and try to serve or sell to nervous, cautious customers. And schools are facing the same double bind. Parents and educators want kids kept safe and in class, but sloppy, irresponsible health protocols often force sick staff, teachers, and children back home, or even worse. Fortunately, Democrats in Congress and President Biden made huge health and economic investments to keep our economy and our classrooms open, safe, and strong, and are continuing to work hard to build back better. Now, while most Americans feel pandemic fatigue, we're starting to approach a turning point as cases are coming down and the economy, jobs, and wages are all up. And making big investments in families and taking simple precautions and getting vaccinated works. We know that. The data proves it. But to really beat this virus, we need to be smart and elastic. That requires collaboration, science, and flexibility. And my friend Lois's Local Health Act fantastic acronym, very impressive, Lois, that does exactly that. This bill affirms the right of public and private employers, including schools, to implement measures that mitigate COVID-19 threats without state interference. Now, whether that's adopting vaccines, testing, or face covering requirements, or taking other safety measures recommended by the CDC, local businesses and officials need the flexibility to use all of those tools instead of having their hands tied, especially in our state, where Governor DeSantis's plan to beat COVID relies on weapons of ignorance, apathy, and schoolyard bullying. He promotes vaccine skeptics. He hires a surgeon general who refused to wear a mask around a breast cancer patient, and he withholds hundreds of thousands of dollars from our schools who are trying to protect children and teachers, and the list goes on. His incompetence is dangerous and irresponsible, and that's not what shop owners and school leaders need right now. They need the flexibility to keep customers, workers, and kids safe and comfortable enough to show up. Instead of threats from the governor's mansion, local school and municipal leaders need the ability to adopt science-based, CDC-backed pandemic measures to keep children, teachers, and frontline workers healthy and protected. When authoritarian governors bully mom and pop shops and educators into risking the public's health or hurting their bottom lines, they need a legal shield. Congresswoman Frankel's bill does just that, but I want to be clear on what this bill does not do. This bill would not mandate vaccines. What it would do is protect the right of local entities to decide how to best keep employees and patrons safe, regardless of government overreach at the state level. Our governor continues to handcuff and pressure businesses and local communities to bend to the whims of his anti-vax political base. The pressure he's put on educators has now infected our top state universities, where he's instilled a chilling climate of fear and muzzling of academic freedom and free speech. His know-nothing, do-nothing COVID policies cost countless loss of life and needless business failures across our state. And now his attacks on voting rights and COVID protections has put the prestige of our top university, my alma mater, at dire risk. We'll never know the real human and financial toll of his ignorance and inaction, but we can mitigate it going forward with legislation like this. All educators and all businesses deserve the security and the flexibility to keep their families, workers, and customers safe. The Local Health Act would do just that, and Florida desperately needs it. Thank you again, Lois, for your leadership.
Thank you, and thank you for joining in this legislation. Now we're going to yield to Representative Hank Johnson over there in Georgia.
Thank you, Representative Frankel. Thank you for your leadership. And I join you in co-sponsoring, as an original co-sponsor, the Local Health Act. You know, it just simply allows for the ability of cities and local businesses to help their employees and others achieve some modicum of health. During a pandemic, we have statewide elected officials playing politics with the pandemic, while local officials and local businesses do their best to try to save the lives of those people that they're responsible for, people who are on locations rendering essential services, frontline workers, and even the public. You know, the public has to have the ability to be safe in order for us to continue to promote the general welfare, in order for us to take care of our families and to take care of all of our responsibilities. And so when businesses help families and individuals protect themselves, we've found now that those same businesses and local officials need the protection of the federal government, because statewide officials are trying to hamstring them. It's ironic that they talk about local control, but yet when local folks start taking control in a very important area, saving lives of the people that they are responsible for, of course, local government hits the road. I mean, that's where the rubber hits the road. When they start trying to protect people and save lives, and then statewide elected officials playing politics with the pandemic get in the way, then that's where the federal government needs to come in and allow the local authorities to have the ability to save the lives of those people that they are responsible for. And so I commend Representative Frankel for this common sense legislation. It's going to help not just in Florida, which is ground zero for executive overreach. It's going to help other places like Georgia, like Texas, and throughout this country. And so I want to thank you, Representative Frankel, for hosting this event. I want to thank all of the local officials who are on this call for being on the front lines and doing what you do in order to protect the people that you're responsible for. I support your efforts. And with that, I yield back.
Thank you. And just to thank you for your comments, Representative Johnson, just to say that all the members on this call today are prime sponsors of this bill. We're going to go to Texas now. Representative Sylvia Garcia, tell us what's going on over there. We're in a race to bottom with you. Who's winning, Florida or Texas?
Well, Representative Frankel, first of all, thank you for inviting me to join you at this press conference. I feel like I'm going to be an adopted Floridian at this point, because Hank and I are the only non-Floridians on this call. But tell you what, you're absolutely right. I think sometimes this is what it's really about. You know, Texas does love to brag about being first and being the best on so many things, but this is one where it's shameful, just shameful, that we are running hard to be number one, because we're actually number two in deaths in the country. And it seems like our governor has this ongoing feud with your governor to see who can outdo themselves in more mandates to local governments, more prohibitions to local governments. And that's why I love the name of your bill, because it's simple. It's Local Health Act, which simply means we need to leave it up to the local officials like your mayor to make the decisions for their community, because they know best. They know best. They're on the ground. You cannot dictate from some faraway capital to people down in local government about what they should be doing or not doing to help the health and safety of their community. I know that this bill would allow business owners to make similar decisions, because it's their business. They know what's going on, to implement common sense safety protections to not only protect the consumers, but their employees and any of the service providers that they use or contractors that come through their facility. So these bans on these safety measures, like the one that our governor has already put in place and tried to get through our legislature, and it failed in the House. It failed. His own Republican-controlled House said no, that they should not intrude into the workings and doings of businesses, that it was government overreach. And quite frankly, it is plain and simple political. It's especially ironic that these politicians who are issuing this bans are the same politicians who claim to support small businesses, who claim to be about local control, who claim to be working there for the people, but it's now they're doing just the opposite. So unlike GOP bans, this bill allows businesses to do what is best for their own facilities. So thank you again for putting this bill forward. I'm hopeful that we can get it into law. I know that there was some guidelines issued, I think, overnight about some vaccination guidelines, but we've got to make sure that it stays in place everywhere. And I think, again, it's about local health, and we should leave it up to the local governments to do, working together with local businesses. So thank you again, and I look forward to working with you to get this bill done.
Thank you, Representative Garcia. Now we're going to yield to Representative Crist, who knows what it's like to be a governor. And I just said as I yield to you, I hope you could answer this question, Representative Crist. Our governor seems to promote that his ban on these vaccine requirements or mask requirements will keep jobs. Could you tell us what happens when somebody dies or sick? Are they able to do their jobs?
Obviously not, Lois. and it's
Okay,
a great
I'm
question.
yielding to you. That was what you call a softball question.
Yeah, well, thank you. I appreciate that, Lois. And let me add to the chorus praising you for this act. It's incredibly important. Those of us who live in states like Florida and Texas and others that have authoritarian governors that are trying to, dictate to our people, our small businesses, our local communities, what they should do and impose their will, need to have this kind of protection and shield, as Debbie put it. Thank you, Debbie, for doing so, because that's exactly what's necessary. And he says that these kind of things are hurting the economy. I'll tell you what's hurting the economy in Florida: 60,000 deaths. 60,000. I mean, think about that. That's more death in one state than the entire United States suffered in the Vietnam War. Now, that gives a little perspective to what we're talking about in the Sunshine State. And so thank you again, Lois, for doing this. It's incredible that you've put this together. I love the simplicity of the name, the Local Health Act. It's important to keep it simple. It's also great to be joined by our colleagues. I mentioned Debbie already. Thank you, Debbie Wasserman Schultz, for being such a true leader, and Representative Johnson and others, Garcia in Texas. Thank you for your being on board. And the dear Mayor of Delray Beach, thank you so much for what you're doing. And this has been weighing on Floridians for months. Governor DeSantis, government overreach extraordinaire. For months, the governor has been telling parents, businesses, and school boards that they can't protect themselves, their customers, and their kids, even during the most recent deadly wave of COVID. I've heard from parents and teachers across our state, and frankly, across the aisle, who are disappointed and baffled by the governor's decision to defund schools that don't comply with his demands, especially when the parents and teachers' primary interest is to keep their kids and their teachers safe in school. This is something you expect out of an authoritarian playbook. And apparently the governor is the author of one, and it's coming right out of the Florida governor's mansion. It's simple. If a business wants to say no shirt, no shoes, no service, they should be able to. That's their right. If a parent or the school board they elect is listening to expert advice to keep schools open and children safe, isn't that their right? It's about respect. Governor DeSantis doesn't know better than parents. He acts like he thinks he does. And the school boards they elect about what's best for our kids. And the results are crystal clear, and they are tragic. Thanks to his soft on COVID policies, Florida has been the global epicenter of the pandemic, not once, but twice. We've lost 25,000 of our fellow Floridians just this summer alone, 60,000 overall, because he went even and let schools or business, he wouldn't let them do what they do and need to do to protect those students and those constituents. Not only is he defunding our schools, his soft on COVID policies are closing them. Florida parents know exactly what an outbreak or an exposure means. If their kid can't go to school, they can't go to work. It makes no sense why he would take the side of the virus over Florida's working parents. And I am so proud to join my colleagues today to support this legislation that will keep the decision-making where it belongs, local. We're here to give parents, the school boards they elect, and the business owners back their power our authoritarian governor wants to take away. And that starts with the Local Health Care Act. Lois, thank you so much. God bless you for doing this. And it's an honor to be on with all the others on the call today.
Thank you, Representative Crist. And now we're going to go to our Floridian from Orlando, Representative Soto.
Thank you, Lois. Colleagues, the report is in. Jobs are up. COVID-19 cases are down, and America is back on track. I'm sure many of you read today over 531,000 jobs, over 500,000 new jobs were created in October, and unemployment continues to drop, according to the new jobs report today out by the Bureau of Labor Statistics. And the reason is clear. It's about COVID-19. Cases are declining and people are getting back to work, and the private sector and local governments are helping lead the way. So why would Governor DeSantis and the Republican state legislators go out of their way to screw up our economic recovery in Florida? Local governments, labor unions, nonprofits, major companies are taking President Biden's lead. The vaccine mandate is working. The masks are working. Mitigation efforts are working, period. This brings us to why we're here today. We applaud Representative Frankel on this new legislation that we're happy to support. This is our direct response to this ridiculous special session. We're helping COVID-19 continue to ravage our state. Seems to be the primary goal. This bill affirms the right of public and private employers to implement measures that mitigate the spread of COVID-19, including vaccine mandates, including mask wearing, including social distancing, testing protocols. These are all recommended by the CDC because we as Democrats are the party of science and reason. And this is how we get out of the pandemic and back to work, as we're seeing with the big jobs report today. So it's time to stop the insanity in Florida. It's time to finish the job and knock COVID-19 out of Florida and out of our nation and continue the momentum of this strong economic recovery we see across the nation. Thank you, Representative Frankel.
Well, thank you. All right, we have some questions here, and I'll see who wants to answer. Let me see where we're going to start. I'm looking at the chat.
No worries.
From Morgan, do you want to ask the questions?
Yeah, Congresswoman, we can also unmute them. So our first, do you want me to just unmute the reporters?
Sure, whatever. Okay, yeah.
All right, our first question is from Alex from Miami Herald.
No worries.
Alex, you are able to speak now.
Well, we could just read his question.
Alex, can you hear us?
Why don't we, I'll just read his question.
Okay.
He says, how does this bill supersede any state law that bans vaccine passports? I'll answer that. That's really a constitutional. The federal government has supremacy, and also because of interstate commerce, definitely the federal law would supersede. And how do you plan? Well, the next one is, how do you plan to pass the bill? Would you be included any legislation that must pass by the end of the year? You know, right now, this is a standalone bill, and we will obviously explore various options. Morgan, next question.
Our next questions are from Joel Malkin from WJNO. Joel, if you want to unmute, you can ask, or I can read them aloud.
Yeah, that's fine. Can you hear me?
Yes.
Yeah, I have a few questions, but I'll go one by one. It's really for anybody or all that want to ask. I've just heard referencing of overreaching by the state, authoritarian at the gubernatorial level. Of course, a day after the OSHA requirement announced that'll mandate the companies with 100 or more employees require workers be vaccinated or test weekly. I just wanted to get reaction on that. You're talking about state overreach, state authoritarian. Would that not be the same coming from the federal government as being overreach and authoritarian? I had a few others if you allow me, but we'll go one by one if you like.
Okay, who wants to take that?
I'll take a bite at that,
Oh,
Lois.
Charlie, okay, go ahead,
Yeah,
Charlie, and then
I
Debbie.
can take part of it also.
Yeah, I think, look, what OSHA is trying to do is keep people safe. What our governor is trying to do is exactly the opposite. And so when you have a situation where you have somebody at a level of government, whether it's local, state, or federal, the one that wants to keep people safe is the one that should have supremacy. And so I applaud what OSHA is doing. I applaud what President Biden is doing, because we have a governor who won't do his job. And he's not protecting our Floridians. He's not protecting our kids in schools. In fact, he's making it hard for them to have masks. Let me give you a personal story. So I've got a 5-year-old niece that lives in Pinellas County, where I live. They did not defy the governor on, on having masks rather in school. And so they have no masks. They acceded to his executive order. My 5-month-old niece goes to school, and they start about 3.5 weeks ago. A couple days thereafter, she contracts COVID. Big surprise. She comes home. She has a 2-month-old sister, my 2-month-old niece. And about 10 days ago, she contracts COVID. So this is what the kind of policies this governor is supporting are doing to our fellow Floridians. And I'm not the only example of it. As I've said, 60,000 of our fellow Floridians are now dead, more than the Vietnam War. It's unconscionable. He's complicit in this. And so OSHA must step in, because he's so reckless, Ron, that he won't do what's right for the people of our state.
Debbie?
Yeah, I couldn't agree with Charlie more. I can't believe that story, Charlie. A 2-month-old, your 5-year-old niece
Yeah.
comes home with COVID and gives the 2-month-old sister
Yes, ma'am. Yeah.
COVID?
It's
Oh my
shocking.
God. I'm so sorry.
Thank
But
you.
Joel, just to address the natural immunity issue, you might not have seen the CDC study that just came out that very clearly said that the vaccine provides more immunity, a lot more immunity than natural immunity does. So we knew all along that that was disinformation and mythological disinformation, and now we have the science and the data to back that up. So there's no question that if you get vaccinated, you have more immunity, and if we have near or almost almost all near vaccination, then we'll be able to make sure that we can accelerate the jump starting of our economy. You asked about the worker shortage. The concern about a worker shortage is that if we don't stop COVID in its tracks by allowing what this local health act would allow for local officials, local business owners to make their own decisions about what they think is best to keep their customers and their employees safe, whether it's masking or testing or vaccine requirements, and not have an authoritarian governor bully them into submission. And by the way, ruin the reputation or damage the reputation of some of our finest public universities, then we would address the worker shortage, because people would be healthy, people would be able to freely circulate without concern. 2-month-olds wouldn't get COVID from their 5-year-old siblings, and those issues would be resolved. But all DeSantis does is play to his Republican base.
You think about all the small businesses, which are the backbone of our economy, and how people can work years to build their business. And an owner wants to keep his business safe. He wants to make sure that his employees are vaccinated or wearing masks, or the customers are vaccinated. And the governor's saying no. It's sad. It really is sad, and it's alarming. And when you think about it, COVID has prevented a lot of people from working, and there still is a fear. But as Representative Soto says, as the jobs are coming back, let's take the fear factor out, and the death factor and the sickness factor out, and allow our economy to keep going on an uptick. Are there any more questions? Oh, Sylvia, go ahead.
Yeah, I just wanted to say that, we have to be, for us in Texas, we're Representative Crist, we're at 70,432. We're number 2 in the nation in deaths. And over 50% of that is minorities, primarily Latinos, because 4 out of 5 Latino workers are essential workers who are working in our hospitals or managing the transportation systems, food supplies. You know the story. And in a lot of those sectors, unless there is a federal law that says that you need to be doing this, quite frankly, I'm not sure they're going to do it, because these are the folks that can't take time off from work because they're working paycheck to paycheck without paid leave, to go to somewhere to get their shots or get tested. So it's important that the companies that need them in that workforce to continue working in the economy and continue putting food on the table and taking care of our families, taking care of our children. It's important, and we want to make sure that they're not exposed and don't get the virus and then pass it on. Representative Crist, I agree with Representative Wasserman Schultz. That's a horrible story that you're telling us, but that can be repeated in any one of these sectors. So we got to make sure that we take care of people, and the way to do that is through making sure that companies can take care of their local health issues, working together with our local governments without any interference from a mandate from the governor's office at some capital far away. So again, it's about putting the responsibility on the business owners who know their workers and their customers best. With that, Lois, I yield back.
Okay. Yeah. Thanks, Sylvia. Just again on the OSHA, just to remind everyone, OSHA has a duty and a responsibility to issue emergency standards when workers face grave danger in the workplace, and COVID is a grave danger. And again, it's no equivalence to what the government is doing. It's actually interfering with local governments and businesses from protecting their employers and their employees.
Lois, can I
Yeah.
add something real quick?
Yes, please.
You mentioned that at the beginning of your remarks that the governor's called a special session in about 2 weeks. And one of the things that they are potentially going to consider is pulling the state of Florida out of OSHA and setting up their own public health safety agency. I mean, that's their response to the premier federal, public health and safety agencies requirements. They're just going to yank us and try to regulate that safety ourselves. I mean, does anyone trust the state of Florida at this point to make sure that they would have an agency that would keep people safe? It is right-wing political extremism run amok.
And Debbie, if I may add, we know why this is happening. Major companies support this. Disney, Universal, our local airlines, we're a tourism state. Local governments, labor unions, major companies, the vast majority of Floridians support this. So this special session is exactly. So this special session is all about the vast majority of Floridians being held hostage by an extreme Republican base that is anti-vax and anti-science, and they're putting our whole state in jeopardy. We can't let an extreme radical Republican minority in Florida in primaries define what is anathema to moderate Republicans, to independents, and especially to Democrats, to put our state at jeopardy. They're holding us hostage and we have to stop them. And that's why this bill's so important.
And I
Congresswoman
think,
Frankel,
yes,
if
go
there's,
ahead.
just want to add one more thing. This vaccinations are not new to our society. And when you're going into other countries, vaccinations are required to get into certain countries. So you have to prove yourself vaccinated. It seems so obscure to me and foreign to me to feel as though this particular vaccination has some different feel when we're talking about life and death. We have seen deaths over and over and over again to such a great degree that anybody who doesn't get vaccinated, I have to kind of like look at them and say, why? I mean, unless there is some sort of a personal, health issue, there is no reason not to do what is in the best interest of our entire society. And on a local level, I believe that, our economy was shut down for months because of this pandemic. And to get out of the pandemic, if all it takes is getting an inoculation in your arm, why would you go against that? It blows my mind. I can't understand it. I don't want to go back to what we were before, where we were locked down because we're having a third or a fourth round, that now we don't have a vaccine that's going to be able to, go up against it and stifle it. I would rather see us all get vaccinated and get in front of this rather than continue to be behind the crest of that wave. It just makes all the sense in the world what we're trying to do. And in past times, take us back to 1918. I mean, people would go try to get that vaccine and get themselves inoculated. Why we have this resistance is beyond me, other than that it's just ignorance being played out the highest levels, or as others have said, political, agendas. Thank you. I yield back.
Thanks, Mayor.
Lois.
Yeah, go ahead,
Lois,
Hank.
Yeah, I would add that Florida has the Florida is number 3 in the country in terms of population, and its economy is way up there in terms of its contribution to the gross domestic product of our entire nation. And Congress has been given the constitutional authority to regulate commerce amongst the states. And so when a pandemic hits, it wreaks economic havoc for the entire nation. And so for one state that is so important to the economy of the nation to be irresponsible with its public health, that gives the federal government the ability and really the mandate to come in the pursuit of the protection of the entire nation's economy, to pass a law such as this one that Representative Frankel has proposed, to protect the general welfare of the entire nation. And so Congress definitely has the authority to pass this legislation. And what it does really is protects the ability of the local authorities to deal with the situation on the ground in the areas of their jurisdiction. And so this is constitutional, and it's also in keeping with the 10th Amendment, which allows for the states to have all powers not vested in the federal government, but again, the ability to regulate commerce between and among the states is a constitutional prerogative that Congress has. And I applaud Representative Frankel for this very common sense legislation that's in response to the overreach of the of the Florida governor insofar as the public health is concerned. And with that, I'll yield back.
All right, and I'm sure Representative Garcia says amen and might argue Texas, whether you're first or second or whatever, right? We're in a race.
Well,
But-
Lois, I think sometimes that our governors are in a race for something else in a presidential year. And when our governor sees your governor do something, then our governor feels like he's got to do something even, crazier. So yes, I think it's a battle of governors, and it's the public's health that is put at risk. And it's hurting not only Texas and Florida, but as Mr. Johnson has indicated, we all travel, we all have relatives, we all move around. That's what a pandemic is. It spreads. So if it happens in Florida, it may come to Texas and vice versa. So we're all in this together. This is why everyone should get tested. Everyone should get vaccinated. And now that children can be vaccinated, they should make sure their children get vaccinated. And with that, I yield back and I sign off because I've got another appointment, so I'll have to drop off. So thank you again for the invitation, and I'm with you all the way.
Thank you. Thank you. Well, I want to thank everybody. If there's any remaining questions from the reporters, if you get them to Morgan or Steve, we'll be happy. We will answer them. I know members have to get back. Some have to get back to the floor. I thank you all very, very much for joining us today. Everybody stay safe.
Thank you, Lois.
Thank you, Congresswoman.